So a CT coronary angiogram is a diagnostic test to image the coronary arteries. A CT scan is a type of X-ray. Ultimately, you are laid on a couch. You go through the CT scanner. It's a sort of like a polo mint shape structure that your body goes through and backwards and forwards, and the scanner spins around, and it takes some cross-sectional images of the heart and the anatomy that's being looked at, and then those images are acquired and processed, and it produces a 3D picture of the heart. And using those images, it's possible to reconstruct usually very good pictures of the coronary arteries, ultimately to assess whether there are any blockages in the arteries and whether there's anything significant there that needs any further attention. So what happens is that you come up to the X-ray department, and a small intravenous cannula will be put into a vein, and some contrast that shows the arteries up on the scanner pictures is put through the vein, and that's all timed as the contrast goes into the vein, and as you're holding your breath, the scanner spins around and it captures a picture of the heart specifically at the time that the contrast is passing through the arterial system and through the coronary arteries, and then that image is processed by the software of the scanner, and the images can be reconstructed to provide very clear pictures of your coronary arteries. So the benefits of a coronary of a CT coronary angiogram are that it provides a good assessment of whether someone has coronary artery disease, and obviously, as some investigations for causes of chest discomfort, that can be very helpful to be able to exclude, for example, that there's no significant blockages in one's coronary arteries. And one of the advantages of a CT coronary angiogram is that you would class it as a non-invasive test. Traditionally, in years past, before the technology for CT coronary angiograms became widely available, if I really wanted to image your coronary arteries, we would be talking about having an invasive coronary angiogram where a small catheter tube is passed into the heart and some contrast dye is injected into the arteries. Now, that's still a very widely used test and is very beneficial and helpful in the right circumstances, but it does have a small risk attached to it. And so being able to get some images of the coronary arteries non-invasively, just from an X-ray scan, obviously in many patients can help avoid the need for those more invasive investigations. In terms of risks of a CT coronary angiogram, well, a CT coronary angiogram is ultimately an X-ray, and so there is a small radiation exposure for that. And so, for example, if you are a pregnant woman, you may not be, your healthcare professional would hopefully be thinking of other alternative forms of investigation if they were ever needed, for example. Ultimately, in isolation, and when it's probably when the assessment of whether someone needs a coronary angiogram is recommended, as a healthcare professional, I would advise my patient that the benefit of getting that information under the right circumstances obviously justifies that very small radiation exposure, and that shouldn't be something too much for the patient to worry about. It's also important to just be aware that the contrast dye that is used to pacify the arteries that then shows up on the CT coronary angiogram, that contrast dye very, very occasionally can cause some allergic reactions. So it's important that if that's happened to you before, that you let the people administering the scan know about that. Also, it may be the case that the healthcare professional has asked to check your kidney function before doing the test, because the contrast dye is excreted by the kidneys. And again, very occasionally, if you've already got some significant strain on the kidney function, that can cause some issues with the contrast dye afterwards. And so it's just important to be aware of your kidney function. And sometimes, if there's some slight strain on the kidney function, we may give some extra fluids to help flush the dye through afterwards to avoid any issue with the kidney function. But generally speaking, a CT coronary angiogram is a very safe, very straightforward, non-invasive investigation of the heart. You should expect that you may have to be asked to have that blood test of your kidney function. You may be prescribed some beta blocker medication, which helps just slow the heart rate down. Remember, the heart is moving constantly, and so if the heart rate's beating very fast, even with the rapid speed of the scanners, sometimes the heart arteries can look blurred. So ideally, the heart rate is generally sitting sort of 55, 60 beats per minute, around that area. Ideally, we wouldn't want the heart rate to be higher than that. That will help get better pictures of the arteries. And so you may be given some beta blocker medication. The scanner itself, yes, you'll have an intravenous cannula put in, but actually acquiring the pictures will take just literally the scanner takes a few seconds to spin around and take the pictures. Afterwards, you'll be advised to drink plenty of fluid to help flush the contrast dye through, but it shouldn't otherwise involve any issue or any ongoing lag effect to cause any concern. Well, so you know, a CT coronary angiogram is a specific test defined in its own right. So it's not directly comparable to other tests. It's used to complement other tests, or it's used as an alternative to other tests, for example, of rather than the invasive angiogram, for example. So it's important that the healthcare professional assesses your heart condition or the conditions they're keen to exclude, and uses the appropriate test. So, for example, if I heard a loud heart murmur and I was suspicious someone had a leaky heart valve, I wouldn't do a CT coronary angiogram as the first investigation. I'd be doing an ultrasound scan. So, you know, obviously there are some heart conditions where, as part of the overall assessment of the heart, you need to image the coronary arteries along with other aspects of the heart function. So yes, you might do a CT coronary angiogram and other heart tests like an echocardiogram and an ECG combined. But there'll be occasions where primarily you're doing a CT coronary angiogram to get an assessment of the coronary arteries and whether anyone's got underlying coronary artery disease, either as assessment of their risk for coronary artery disease or whether the patient's actually got symptoms of chest discomfort, and you're trying to confirm or exclude whether third up arteries is a cause of that discomfort.